What is scar work and how does it differ from other types of scar treatments? The manual therapy scar work that I do is a very light technique that's aimed at reintegrating the scars that you might have wherever they might be from an accident or a surgery. And a very conventional approach to scar massage historically has been breaking up old tissue. How is the tissue formed and how do we get that to break up? And it has this very adversarial approach to the scar. The work that I do is a much softer work that's work thinking about that this tissue um, isn't like out to get us, that the scar tissue served its purpose to help our healing. Whether it literally helped hold us together so that our wound could heal and we wouldn't bleed out, or whether it held things together so that we could continue to um, heal an area. If it weren't for scars post surgery, we might not be able to recover as the stitches dissolve. We need something to hold our body together as that scaffolding. But now that usually when people come to me for scar work, the idea is now what? The scaffolding is up and it's time to take the scaffolding down. Unlike scaffolding on a house where you just unscrew and bolt the scaffolding and remove it, and you've got the roof or whatever you've been building there. This is part of the body, and it was tissue and needs to be reabsorbed into the body. And that's the analogy I use is not breaking up the tissue, but helping to melt it back into place. So you have very gentle techniques that are exploring the tissue and not trying to irritate it, but trying to wake it up and get the scar to sort of reabsorb and heal. Sometimes I have the analogy of um, if you had a bunch of bread dough and there was a dry clump in the bread dough, and you wanted to moisten that clump and have it part of the bread dough, you don't just rub at it and try to break it up. That just causes it bead and maybe you'd have to remove it, and that's more of a surgical approach. Instead, you knead around it, you moisten it, you try to get it to absorb back into the massive dough that you're working with. In this case, I end up using techniques such as gentle brushing, some we refer to as feather dusting across the scar, and then you can do a finer tooth combing when you're getting more detailed. Um, there's a matching of layers. Sometimes when people have longitudinal scars, such as from a mastectomy, whether that's cancer related or a gender affirmation surgery, or a longitudinal scar lower down when you're dealing with a C-section, those scars have two planes of tissues that in some cases there was tissue in between and it's being stitched together. Now, these two planes of tissues may not have been neighbors prior. So you've got some type of tissue, skin tissue, and another type of tissue that have just been sewn together and are expected to become neighbors. And I think of my work is sometimes to be a little bit of a mediator and help to introduce those layers together. So I may get a hold of each side of that and gently move back and forth, and with a little bit of a shearing motion, but not in the idea that I'm hurting anything, and trying to just explore that sensory response and having those tissues connect with each other. Now, what level we're working with, I'm not sure, but it seems to be that we're dealing with the sensory system in the body. And when I do this work, people have more sensation. The scars seem to pinken more. Sometimes they get a little bit itchy, but that's sort of the healing process. And blood flow goes to them. And the contour between those two layers that have been stitched together starts to feel like a whole. It starts to feel like this scar is being integrated into your body. And whether there used to be tissue between them or not, there is more of a full system. And that's often what I'm looking at. Holism in terms of this is one organism and how do we reabsorb versus just remove the old scaffolding, which is a very mechanical approach. If you want to hear more about the scar work that I do and theories about scar work and integration, check out the other YouTube videos that we have, and there's a few more that will further discuss that. You can also visit my website or reach out to me directly. I'm always happy to answer questions.